Hi, my name is Gabby, and today we're going to be doing another palpation video. For this palpation, I decided to palpate the Flexor carpi ulnaris. So let's begin with the benefits. The benefits, it will help me determine if there's any abnormal resting state of the muscle and overall abnormalities, and some of the risks that I could reproduce pain or discomfort if there is any abnormalities present in the muscle. So origin of the Flexor carpi ulnaris is the medial epicondyle, like all the flexors of the wrist. And then the olecranon process, and then the insertion is the pisiform bone found in the hand, the fifth metacarpal, and then the hook part of the hamate bone. One of the actions is the prime mover of wrist flexion. It also does ulnar deviation, and the fibers run vertically. So let's begin. I have a marker here. I realized in the last video that you couldn't really see what I was palpating. I don't know if it's the lighting in my room or if I'm just because I'm pale, but we'll make do with what we have. So again, my landmark is going to be my medial epicondyle. So right there, my medial epicondyle of my elbow, sorry. And then my other landmark when I'm traveling distally will be my pisiform bone found right there. It's very prominent. It's kind of like a ball, like a little ball there. So I'm just going to mark that there. That's my pisiform bone. And like I mentioned earlier, wrist flexion and then ulnar deviation. The thing and how to activate it again, if you have a weight, you can do wrist flexion, ulnar deviation. The thing is here is that you don't need a lot of resistance to actually activate the muscle. Like right now, what I'm doing, I can totally feel it just pop up right into my hand. So when I like to do this palpation, I don't even ask the patient to have any weight on them. I just have them perform the action that it does, which is flexion of the wrist and then ulnar deviation. So let's begin. Again, either with your thumb or your two fingers. I'll do my two fingers just because I'm comfortable with that. So medial epicondyle, I'm going to flex my wrist and then ulnar deviate. And I can feel it pop up right into my hand. And I'm going to do that periodically. So I'm just going to keep doing it because then that way I can really feel it pop up into my hand. Then from here, so there is no temperature. Tenderness, I don't really have any tenderness here. Tone is normal, and so is the texture. Can really feel it pop up here. And then as you go distal, you have to kind of dig in a little deeper in your palpation, just because here's the meaty part. When you get down, it kind of gets thinner, so you really have to kind of cross fiber palpate right here. And this one's actually quite an easy one because this is the palmaris longus here. Right next to it here, that would be your tendon for your flexor carpi ulnaris. So you can just kind of follow that. Once you get to the tendinous unit here, just kind of cross fiber the tendon here. All the way to the pisiform bone. Right there, hook of hamate would be right here. If you really palpate it, you can feel it. And then fifth metatarsal right there. And that would be your palpation of the flexor carpi ulnaris.